Hi, we're here today with Dr. Alvin Gajadhar, and he is current president of the ICT. We're talking a little bit on the importance of diagnostic testing and Trichinella control. Dr. Gajadhar, how important is testing in Trichinella control?
Uh, Testing is very important because Trichinella, as you may know, has been around for about over 150 years. And over this period of time, it's well recognized that animals don't become sick, so you don't really know when they have Trichinella. People become sick when they eat meat infected with Trichinella. So it's difficult for people to know when to test animals to see if they're infected and if they're a risk to humans. So there are various programs in place to test pigs and other food animals susceptible for Trichinella to make sure that they are free of Trichinella so that people don't become infected and especially when they eat meat that's not fully cooked, it becomes a risk and it's a serious disease for humans. So the reason for testing again is to avoid people from becoming ill, from contracting the disease, but also to make sure our food supply is free of the parasite.
Okay, and what is the current status of diagnostic tests, and maybe what are some of the needs?
Well, this is a big area for us in the International Commission on Trichinosis because we've had very few tests over a period of 150 years. Over 100 years ago, we first had a simple test that was called a trichinoscope, where you take a piece of meat and put it between a couple of pieces of glasses, you squash it down, and you look for the parasite in that very thin piece of meat. That was used for many, many years. At one time, places like, for example, Germany, they had employed over 100,000 people just looking for Trichinella. Many places still use that. It's a very quick test, and especially where Trichinella is epidemic, is endemic. In areas where it's not so common, then that test is not sensitive enough. So there are two things that are used. They use a digestion assay, and that takes a lot of time, and it's the best test we have to see whether an animal or a piece of meat is infected. We also have a serological test, and there's been great advances in that area. And currently, it's being used in some countries, and other areas it's not being used as much. So, but there are certainly improvements to be made in all these tests, and that's something the ICT, the International Commission on Trichinosis, is promoting. So there's a lot of need in this area.